Hey there, welcome back to Midnight Med. This video will be on immunization in pregnancy. Vaccines are administered to pregnant women to protect them from complications that they are often at increased risk of due to biological and physiological changes. Vaccination also protects their unborn child through passive immunity, initially through the placenta, and then through colostrum and breast milk after birth. Prior to pregnancy, it's important to check for immunity to hepatitis B, measles, varicella, and rubella, and vaccinate for these if needed. Vaccinations should also be undertaken for any other infections that the woman may be high risk for. Importantly, it's important to avoid pregnancy within 28 days of delivering a live vaccine, such as those for measles, varicella, and rubella. The two key vaccines that must be given to all women in pregnancy are in bold: influenza and pertussis as part of the DTPA vaccine preparation. For individuals at particularly high risk of certain infections, there are other vaccines that need to be administered. Those with asplenia, immunodeficiency, or a hematological malignancy are at risk of significant Haemophilus influenzae type B infection and should be vaccinated for such in order to facilitate passive transfer to protect the child. Those with chronic diseases like chronic heart disease, chronic liver disease, diabetes, and immunodeficiency should be vaccinated against pneumococcus with either the 13-valent conjugate or the 23-valent polysaccharide vaccine. This has been shown to decrease maternal pneumonia, bacteremia, and otitis media, and the benefits of passive transfer are present for the child here also. Those who have a complement deficiency, live in an endemic area, or live in a dormitory or barracks where they are in very close contact with others should be vaccinated against meningococcus. This decreases the risk of maternal seizures and neurocognitive abnormalities. Again, there is important passive transfer to the child. Typhoid and polio vaccines are offered if the pregnant lady is traveling to an endemic area. Hepatitis A and B vaccines are offered if the pregnant woman has previously been exposed to either or if she has a high risk of complications. Remember that either can be acute if infection sets in, but hepatitis B can cause chronic disease in the child. There are some key complications to be aware of when dealing with vaccine presentable disease in pregnancy. If they contract influenza, pregnant women are at an increased risk of complications, cardiopulmonary ones in particular. They are also at risk of hospitalization and potentially even mortality. It is worth noting, though, that the evidence for these three risks is mixed. In the baby, the infection appears to be associated with low birth weight, preterm birth, stillbirth, neonatal death, and spontaneous abortion, and again, there is mixed evidence for these. There is more robust evidence for associations with congenital abnormalities, such as neural tube defects and congenital heart disease and cleft lip. Vaccination for influenza decreases the risk of all these complications, and it's important to initiate oral antivirals promptly if a woman is at all infected. With a pertussis infection, adults, including pregnant women, are largely asymptomatic, but these pregnant women can transmit to young infants, and it is the young infants that are at risk of hospitalization and even death. Vaccination allows passive immunity from mother to child, and this is essential because infant immunity under the regular vaccination schedule doesn't fully develop until about 6 months of age. Measles, varicella, and rubella are important because all three are associated with complications. A measles infection is associated with an increased risk of preterm birth, low birth weight, and spontaneous abortion with infection. A maternal varicella infection can have respiratory complications and can lead to neonatal infection or congenital varicella syndrome. Congenital varicella syndrome occurs in 0.5 to 1.5% of all pregnancies where the mother is infected and is characterized by scarring, limb hypoplasia, and low birth weight. A maternal rubella infection is associated with lymphadenopathy and arthralgia and can lead to spontaneous abortion, neonatal death, or congenital rubella syndrome. Congenital rubella syndrome is seen in 1 to 2% of pregnancies where the mother is infected and is characterized by deafness, cataracts, cardiac defects, and neurological defects. A schematic is below. Importantly, measles, varicella, and rubella are all vaccinated against using live attenuated vaccines. While there is a theoretical risk that all three of these can revert to an active form and cause serious disease in a vaccinated mother, therefore putting the baby at risk of significant complications, evidence that this occurs practically is minimal. Despite this lack of evidence, we still refrain from vaccinating pregnant women and hold off until birth if she is not vaccinated against any of these. So that's it. Thank you for watching. I hope that was useful. Don't forget to like, subscribe, follow us on Instagram at MidnightMed1200 for more, and we'll see you in the next video.